Dr. Kenneth Gehman. I'm a general thoracic surgeon here in Thunder Bay. A PET CT scanner allows us to image lung cancer and determine whether there's been any spread of the disease. PET CT scanning is largely only used in Ontario for lung cancer and other special circumstances with different kinds of cancer. Well, PET CT scanning has been shown to accurately stage the disease or determine whether there's been any spread of the cancer, and that very much influences how lung cancer is treated. PET scanning or positron emission tomography is actually a functional form of imaging, and by that I mean that it actually tells us information about the function of someone's cancer, how aggressive the tumor is, whereas CT scanning and other forms of imaging only tell us about anatomy. They don't tell us anything about how aggressive someone's cancer is, and also doesn't. It also gives us an assessment as to the likelihood of a lesion being a lung cancer, whereas CT scanning only gives us information about anatomy, the size of the tumor, those sort of issues. Those isotopes currently have a very short half-life, so when the isotope is produced, it has to be utilized within hours of its production. So currently we are obtaining those isotopes from outside of Thunder Bay, from Southern Ontario. Once we have a local cyclotron, it will actually allow us to have greater access to PET, because instead of shipping in the isotope and only being able to do limited numbers of scans, having our own cyclotron will allow us to produce our own marker, and also would allow us to do other PET-based investigations, which would improve local care. Well, PET CT scanning is very expensive technology, and there's no question that if we did not have such imaging, that we would not be treating patients with lung cancer with the standard of care that would be expected in the 21st century.